Hey guys, this is Jim from Gynecomastia Surgery Cost Guide again. Here's another audio version of the blog post that I put up on the website for you all. Once again, not the sexiest video you ever see on YouTube, but hopefully it's a little bit more engaging. So this blog post is entitled "What to Expect from Gynecomastia Surgery Before and After." So a lot of people who are interested in gynecomastia surgery really want to be able to understand as much about the procedure before, obviously, you head to the hospital and you actually get your procedure done. So there's a few things that we have to cover in this brief video. For anyone who's not really aware about how the whole process that leads up to the actual surgery happens, here's a little bit of a behind the scenes. What you're going to do is you're going to end up meeting with your surgeon, and you're going to walk into his or her office, and you're going to sit down, and they're going to kind of just ask you some questions to kind of just get to know you a little bit better. They kind of want to know about what your life is like with gynecomastia. What do you do as far as your job? How has living with gynecomastia been? Do you have any pain? And they just kind of want to get an idea of your lifestyle overall. So that's kind of the initial consultation. And then at that point, what will happen is your surgeon will tell you, okay, now these are the next steps. We're going to do some blood work. We're going to, the next time I see you, we're going to maybe be in a different room, and I'm going to ask you to, take your shirt off, and then I'm going to kind of explain a little bit more about, what might happen if we actually do go to the actual next step of getting you in the operating room. Now, after your initial consultation, like I said, you'll meet with your surgeon, and he or she will ask you to remove your shirt. They'll touch your chest. They'll make a determination. They might, try to do a little bit of evaluation by, pulling out a marker. They might draw on your chest to kind of let you know, okay, well, this is typically what I do with my patients. I make an incision here. I cut here, and then I stitch here, and they kind of give you an idea of what you can overall expect from surgery. Another thing that'll happen, and this will actually usually happen in the initial stage, in the consultation stage, is that you'll be able to see before and after pictures of gynecomastia procedures that, the surgeon has done, which really gives you an insight into seeing not only what other people who have gynecomastia look like, so you can get an idea of everything from a mild case to a very severe case, and then you can kind of see where you fall in the middle. But it gives you a clear understanding of what you can expect from your surgery. There's not really any guesswork here. You can kind of see, wow, look at the surgeon has done this many surgeries. Look at all the before and after pictures, and he'll explain. Maybe he'll give you some really great results from the surgery, and maybe he'll show you a few results that aren't so good. Maybe a few people who had severe scarring, or some people who, maybe the surgeon cut into the glandular tissue, or tried to take it out a little too aggressively, and there's some crater deformities, which basically makes your chest look a little bit concave. So it's almost the opposite effect. Instead of it being extremely overt, it's a little bit more concave, and little extra skin and things like that. So what I'm basically trying to say is that your consultation with your surgeon will kind of set the stage to help you understand what's going to come next. Okay, and then after you do everything you need to do, let's talk about life after the surgery very quickly. You'll be able to leave the hospital the same day as your surgery, typically. You're going to need someone to drive you home. You're not supposed to drive for about a week, okay? You're going to need a few days off from work. Depending on the actual work you do, it could be a week, it could be 2 weeks. It really depends. If you have a manual labor job, you're going to need to stay off your feet for a while. If you have a desk job, you might be able to be back at work within a couple days. And you're also going to want to make sure that you don't get your stitches wet. you know, that's going to be still a healing process, and you don't want to aggravate that. You also don't want to stay in the sun too long. You know, there's a worry about scarring, and so you want to follow the advice, or really I should say follow the instructions that your surgeon gives to a T. It really shouldn't be too many, but you know, the obvious theme is going to be after your surgery, you're going to need to take it easy for a while, and you really need to follow the instructions given by your surgeon so that you can get the results that you ultimately want. Another thing that you might not know about, which is important to keep in mind, is that you might be asked to have yourself or someone, you know, a loved one or a friend, help you with the drains that may be attached to your body after surgery. The drains help keep the blood and the fluid that would typically, you know, that can collect in sort of the cavity where the breast tissue, the glandular, the gland that was causing the gynecomastia, where that was removed, you know, that's been excised, and now there is a fear that blood and fluid can kind of get in there and, you know, cause problems, and, you know, it can be a little bit of a mess. So that's a way in which, you know, the blood will kind of flow outside of the body rather than inside of that area where you got your procedure done. And, you know, the drains have to be literally, you know, poured out because they fill up with blood. So you know, it can be a little bit uncomfortable for a while, but it's something that is necessary for some patients, not necessarily for all, but certainly for some, for a good many. So that's really all, guys. Hopefully that helped a little bit. And once again, if this video helped you all, even just a little bit, I'd appreciate it if you could maybe give a thumbs up to the video. You can like it, and that way other people can find it a little bit easier who are also dealing with gynecomastia. I think it's really helpful if we can kind of build a community that everybody just feels welcome and we can all help each other. And if you want to have a little bit more information, excuse me, I have more blog posts, and I have a link to this particular blog post in the description. So head over to gynecomastiasurgerycostguide.com, and you'll be able to find everything you need, and I'll be making more videos for you guys. Hopefully they're a little bit helpful. Thanks, guys. Have a great day.